Hello, good morning to you all. So, from today, we are going to start some topics which are very much beneficial for you in your intensive care unit postings. So, my first topic is in management of hypertensive crisis. So, what is the outline regarding in which we will talk about is recall the pathophysiology, diagnosis, symptoms, epidemiology, causes and types of hypertension. Second is recommended an appropriate treatment plan. Third is discuss management of hypertensive crisis. Fourth one is learn the different drug used in case of hypertension and provide appropriate patient education. So, what is the definition of hypertension? According to WHO, hypertension, also known as the high or raised blood pressure, is a condition in which the blood vessels have persistently raised pressure. So, this is according to the WHO definition. Blood pressure is created by the force of blood pushing against the walls of blood vessels, means arteries, and which lead to arterial blood pressure in millimeter Hg as it is pumped by the heart. So, first one is systolic blood pressure. Acute during cardiac contraction. Second is represent the cardiac output, and third is first Kotakov sound. We are talking about the systolic blood pressure. So now, what is diastolic blood pressure? Acute during ventricular relaxation, which represents peripheral vascular resistance of blood vessels. Fifth or last Kotakov sound. So, epidemiology. Hypertension is the leading cause of cardiovascular disease and premature deaths worldwide. And we Indians are most sufferers in such cases because there are 1.13 billion people worldwide have hypertension. 1 in 4 men and 1 in 5 women have hypertension. Findings of recent studies in Lebanon have shown that hypertension affects one third of the Lebanese population and an additional 30% are pre-hypertensive. And the prevalence in Lebanon is about 31.2%. 75% of the Lebanese aged more than 65 years have hypertension. 60% of hypertensive patients are receiving medical therapy. So now we come upon the types of hypertension. There are stages 1 and 2, and one is white coat hypertension, and fourth one is crisis. So, what is stage 1? Stage 1, when हम कब बोलते हैं कि ये stage 1 में है? When systolic blood pressure is about 130 to 139 mmHg or diastolic 80 to 89 mmHg. In the second stage, systolic blood pressure at least 140 mmHg and diastolic at least 90 mmHg. What is white coat hypertension? When the blood pressure is continuously elevated by the office readings but does not meet diagnostic criteria for hypertension based upon the office readings. इसका मतलब ये हुआ कि वाइट कोट हाइपरटेंशन जब भी पेशेंट डॉक्टर के पास जाता है उस समय उसका ब्लड प्रेशर बढ़ जाता है, और जब नॉर्मल कंडीशन में उसका ब्लड प्रेशर नॉर्मल रहता है, जिसे वाइट कोट हाइपरटेंशन कहते हैं, विच इज़ रिएक्शनरी टू द वाइट कोट. एंड व्हाट इज क्राइसिस? व्हेन the systolic blood pressure is more than 180 mmHg and or diastolic blood pressure is about 120 mmHg. It is also known as the emergency with acute target organ damage and urgency without acute target organ damage. So, what is target organ damage? In which you are getting some disturbance in ECG findings in heart chambers and in eyes and in kidneys. So we will talk it about later. But first, we know about the first pathophysiology of the hypertension. Here, this is the diagram in which what we are saying that the this these are the arrows in which like the liver is producing angiotensinogen, which leads to angiotensin 1, and which is converted to angiotensin 2, and which acts upon the kidney, and which and then the aldosterone secretion is there. What is angiotensin 2 effects is arteriolar vasoconstriction and increase in blood pressure. So what is angiotensin 2? Again in the pituitary gland and in the posterior lobe, which leads to ADH secretion. So what we are observing is that blood pressure, we have to manage the blood pressure on the crisis in an emergency basis, as well as we have to treat about the white coat hypertension, as well as the BP of stage 1 and stage 2. So signs and symptoms of hypertension. So first see that what hypertension causes in our body, what are the signs and symptoms which can lead to the further problem, like severe headache, severe chest pain, nausea and vomiting. Fourth one is shortness of breath, and severe anxiety and seizures, and unresponsiveness to the many things. So the signs and symptoms are clear. Mostly we are saying that patient is complaining of severe headache, and but जब उसके इन्वॉल्वमेंट हो जाता है लंग्स का इन द लोअर बेसिस, व्हेन देयर इज लेफ्ट वेंट्रिकुलर डिसफंक्शन, देन we will find shortness of breath. Severe anxiety also leads to hypertension, as well as hypertension also leads to severe anxiety. This is a vicious cycle. Many times you are observing that patient comes with history of seizures. At the time when we are going to treat that patient, at that time we have to manage hypertension as well as the seizures. And nausea and vomiting are also some special features of hypertension. So we have to correct everything depend upon the chart. So what is hypertension emergencies and what the blood pressure is more prominent in each organ. Like when the blood pressure is about 180 to 120 systolic, it affects the many things. Like we are already concerned about is that it affects on the brain, it affects on the eyes, it affects on the myocardial tissues. It may lead to back pain when aortic dissection is there. It may lead to left ventricular dysfunction, in which we are getting the local cramps, the vessel cramps in the lungs. It affects the acute kidney injury, and in case pregnant women, when the blood pressure is more than 180 by 120, we are getting eclampsia. So what we are getting in visual effects, we are getting the visual disturbance, papilledema is there, flame like hemorrhages are there. So by this chart it is very much clear to us. And in case brain, the stroke symptoms, many times we get the stroke symptoms, and delirium or agitations and head injuries. So by this chart it is very clear, very much clear to us that what the hypertension affects in our body, the other organs which are affected by the hypertension, and what are the signs and symptoms we are getting at that time. So the next thing is the tests to be done in case hypertension is like EKG, means electrocardiogram. Second is conventional chest radiography. Third is urine analysis. Fourth one is serum electrolytes as well as serum creatinine levels. Some cardiac biomarkers also which we are using, like CPKMB or troponins, troponin I, like troponin IRT, and CT scan or MRI. Many times we are getting that the patient comes with the complaint of seizures, or patient comes with the features of lateralization in one half of the body. At the time we will think about the possibility of stroke, like in the previous slide. You know that the stroke symptoms are there, and So at the time, CT scan is mandatory, and CT scan is very much helpful for us. Second thing is, if we have the facility of MRI, so we should go for the MRI, and it is much more beneficial for the patient when the patient comes initially to the doctors. Second is conventional radiography, in which if there's a if we think about that the patient is suffering from hypertension, at the time we will also get the cardiomegaly in the chest X-ray. In case urinalysis, we get many times you get the possibility of nephropathy is there, so many times you'll get urinary proteins. That is serum electrolyte and creatinine. So when the patient is suffering from kidney disease, उस समय हम लोगों को creatinine उसका high मिल सकता है. Fourth one is cardiac biomarkers. When the patient comes from chest pain, at the time, if we think about that the patient is suffering from any angina or any 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 complaints which comes under the acute coronary syndrome, at the times we'll send the cardiac biomarkers और CT scan MRI का तो मैंने आपको बता ही दिया. इसमें एक चीज़ इम्पोर्टेंट ये है कि what we are getting in ECG. So in case ECG, if the patient is suffering only from blood pressure and not from any kind of chest pain, so ECG हम लोग जब इसमें देखते हैं तो हम लोगों को all the 12 leads हम लोग इसमें प्रॉपर तरीके से ऑब्जर्व करते हैं. फर्स्ट हम लोग तो उसके अंदर एक बार एक चीज़ है कि first we are getting some problem in case left ventricular functions, और ECG में हम लोग देखते हैं कि we are getting LVH by voltage criteria. What is LVH by voltage criteria? It is that if like in 12 leads ECG, 1, 2, 3 IVF and V1 to V6, what V1 is, V2 is, V3 is, and what V4, V5, V6. So if the sum is near about V1 to V6 is more than 35 mm, and 1 mm is equal to one small box, and one big box is 5 small boxes, so the value of that box is 0.01, so 0.02, right? So LVH में हम लोग देखते हैं कि V1 plus V5 is more than 35 mmHg, so LVH is there. और ब्लड प्रेशर की वजह से many times you are getting that there is a left ventricular hypertrophy by voltage criteria. If you want to confirm it that what is the actual situation, if it is not clear by the ECG, then we will go for the echocardiography, in which we will easily see about the walls of the chambers and as well as walls of the cardiac tissue. So this is the EKG, which is very much essential for the doctor to send the patient for the functions of ECG. Like in the previous slides, like I want to show you that what is stage 2. Stage 2 is more than 140 mmHg or diastolic at least 90 mmHg. So in case stage 2, it is not many times it's not necessary to treat the patient, but 140 by the 90 when we are seeing in the routine practice, then we have to treat 140 by 90 by some small drugs, and which depends upon the age of the patient as well as the group of the patients. Why I am talking it again, because the signs and symptoms of hypertension is based on the severity of hypertension. So we have to first we have to think the actual signs and symptoms of the patient. If seizures is there, or if सीवियर एंग्जाइटी अगर हो, या पेशेंट को शॉर्टनेस ऑफ ब्रेथ हो, तो उसको इमीडिएट बेसिस पे हम लोग ट्रीट करते हैं. सो यू शुड लर्न in your clinical practice the signs and symptoms are very much beneficial in case the treatment of the patients. So now I just want to talk to you about the guidelines for the measurement of blood pressure to diagnose and to treat hypertension. So in this cases we'll talk about the patient condition, what is the actual condition of the patients. So posture. Initially check for the postural changes by taking readings after 5 minutes supine, then immediately and 2 minutes after standing. This particularly important in patients older than 65 years age. So हम लोगों ने क्या देखा कि पोस्चर इज़ वेरी इंपॉर्टेंट. वाई पोस्चर इज़ वेरी मच इम्पॉर्टेंट? Because we are taking the readings after 5 minutes, and 5 minutes supine, then immediately, and 2 minutes after standing in the particularly important in the patient's ages more than 65 years age group, and the diabetics or those taking antihypertensive drugs. So posture is important, and we should take at least 2 readings in each posture. So circumstances: no caffeine during the hour preceding the reading, and no smoking during the preceding 30 minutes. तो क्या हम लोग इसमें चाहते हैं? हम लोग इसमें चाहते हैं कि कोई भी ऐसे प्रेसिपिटेटिंग थिंग्स जो कि ब्लड प्रेशर को बढ़ा सकती है, वो हम लोग उसको अवॉइड करना है. तो कैफीन वाले प्रोडक्ट्स एटलीस्ट 1 घंटे के पहले तक तो नहीं लिए जाने चाहिए. और जो स्मोकिंग है उससे भी ब्लड प्रेशर की रीडिंग्स में चेंज आता है. सो we should guide the patient not to smoke during preceding the 30 minutes of the taking the blood pressure. No exogenous adrenergic stimulants जैसे कि phenylephrine, जैसे कि in case of deconsent, or eye drops for papillary dilatation. A quiet warm setting is important, and home reading should be taken upon the varying circumstances. So हम लोगों ने यहाँ पर क्या देखा कि पोस्चर इज इम्पोर्टेंट एंड सर्कमस्टांसेस ऑफ द पेशेंट इज ऑल्सो इम्पोर्टेंट. सो मेन गाइडलाइंस ये उसके अंदर कहना पड़ेगी कि एटलीस्ट 1 घंटे पहले तक, आधा घंटा, एस दे मे रिटन इन द बुक्स, सम बुक्स ऑल्सो प्रिस्क्राइब नियर अबाउट हाफ एन आवर एंड समथिंग, एंड समवन टेल्स अबाउट द 1 hour प्रेसिडिंग टू द टेकिंग द ब्लड प्रेशर. एंड कोई भी तरह की कॉफ़ी कैफीन वाले प्रोडक्ट्स हम लोग नहीं लेंगे, अदरवाइज इट विल increase the blood pressure and will get the false reading of the patients. And then equipments. What are the equipments which we are using in these patients? So cuff size. First we'll talk about the cuff size. Actually why it is important? आप लोग सोच रहे होंगे कि अगर हमको ब्लड प्रेशर का इंस्ट्रूमेंट मिल गया, हमने ब्लड प्रेशर लिया तो बात खत्म. नहीं. Important is that the length of the bladder should be 80% and the width of the bladder should be at least 40% of the circumference of the upper arm. क्या मतलब इसका? इसका मतलब ये है कि जो ब्लैडर का जो टोटल जो रबर वाला जो पार्ट होता है वो एटलीस्ट 80% होना चाहिए, should be 80%, and width of the bladder should be at least 40% of the circumference of the upper arm. What is nanometer? Android inquiries should be calibrated every 6 months against a manual mercury manometer. Okay, so now the techniques. Like अब देखते हैं हम लोग कि जैसे NAVH की प्रैक्टिस में लोग स्कूल्स में चालू करते हैं, वहाँ पर मर्क्यूरी वाला जो BP इंस्ट्रूमेंट है उसको बंद कर दिया. इनफैक्ट किसी भी तरह की मर्क्यूरी ऑर्गन्स, क्योंकि वो मेटल पॉइजनिंग और वो काफ़ी डेंजरस हो सकती है, दैट्स व्हाई वी आर अवॉइडिंग इट. एंड द टेक्निक, नंबर ऑफ रीडिंग्स. आप देखिए टेक्निक इज़ ऑल्सो इम्पोर्टेंट, क्योंकि आपकी टेक्निक ही डिसाइड करती है कि पेशेंट को ट्रीटमेंट हम लोगों को क्या देना होगा. अगर आपकी टेक्निक सही नहीं है तो मेनी टाइम्स यू विल गेट गो इनटू द ट्रबल. सो नंबर ऑफ रीडिंग्स, टेक एटलीस्ट 2 readings on each visit, separated by as much as time as possible. If readings vary by more than 5 mg, the additional readings until the 2 consecutive readings are close. So for the diagnosis of hypertension, take 3 readings at least 1 week apart. Initially, take the blood pressure in both the arms. If pressures differ, use the high arm. So क्या पता चलता है इस चीज़ से? ये पता चलता है इससे कि एटलीस्ट वी शुड टेक 2 readings in each visit. और अगर दोनों में 5 mm जिससे का अंतर आ जाता है तो फिर हमें 3rd रीडिंग लेना पड़ेगी. हम लोग ये बस व्हाट वी वांट टू डू इज we should take the additional readings until the 2 consecutive regions are very much close for it. And for diagnosis of the hypertension, हम एटलीस्ट 3 readings को मान के चलते एटलीस्ट 1 week के अंतराल पे. ओके, और हम लोग दोनों ही आर्म्स में we can take the blood pressure in both arms, and I will differ, use the high arm. That is very much clear to us, and many times you are using this practice as well. So number of readings is important. Performance, initially the bladder quickly to 20 mmHg, above the systolic pressure as was estimated from a loss of radial pulse. Deflate the bladder by 3 mHg per second. Okay, क्या deflate the bladder by 3 mHg per second or inflate the bladder quickly by 20 mHg above the systolic pressure. Okay, if the cortical sounds are weak, have the patient raise the arm upon and close the hand 5 to 10 minutes and then inflate the bladder quickly. So इसमें क्या है, अगर हमको cortical sounds अगर बहुत ही वीक मिलते हैं तो क्या करना पड़ेगा, have the patients raise the arm. Okay, very much clear to you. Open and close the hands 5 to 10 times. Open and close the hands. Okay, and then inflate the bladder quickly. So what about the readings? What about the recordings? What we are getting in? Note the pressure, patient's position, arm and cuff size, such that 140/90 and seated right arm is a large adult cuff. Okay, so this is the blood pressure instrument what we are seeing here. This is the mercury manometer. But nowadays, as if we all talk about the NIBS, then they are not using the mercury instruments, but they are using this kind of instruments which we आप लोग इस पिक्चर में देख सकते हैं. लाइक एलिवेट आप इसमें देखें कि इस तरह से ब्लड प्रेशर का क्या सिग्निफिकेंस हो रहा है, आप क्या इसमें देखते हैं. सो elevate the cuff wrist to heavy level, keep your back stretched, relax your wrist on the hand, sit comfortably on a chair with your feet flat on the floor. So अब देखिए इस पिक्चर में आपको कैसे समझ आता है. अब इसमें देखें कि एलिवेट कर रहा हूँ अपने हैंड को, कफ को. दूसरा है कि आपको स्ट्रेट एकदम बिल्कुल बैक एकदम सीधी होना चाहिए. आप रीड गेट भी आपकी टच रहेगी तो आप जंग से प्रॉपर तरीके से कर सकते. रिलैक्स योर रिस्ट एंड हैंड, आपके रिस्ट और हैंड्स को आप बिल्कुल रिलैक्स कर दिए. आराम से कंफर्टेबल बैठिए, क्योंकि कंफर्टेबल बैठने भी आपका प्रॉपर तरीके से भी ब्लड प्रेशर मैनेजमेंट आपको देखा जा सकता है. तो नाउ अब हम देखते हैं कि देखो, एक तो फार्माकोलॉजिकल ट्रीटमेंट होता है, एक नॉन फार्माकोलॉजिकल ट्रीटमेंट होता है. मेरे टाइम्स पेशेंट ये आपसे पूछता है कि अगर उसको ब्लड प्रेशर है तो क्या उसे लंबे गोलियाँ लेना पड़ेगी हमेशा. उस समय उसे डर होता है कि एक बार ब्लड प्रेशर की गोली चागेज होती है जो कि नॉर्मली ढांती है लोगों के बीच में. तो इसलिए जो ब्लड प्रेशर की जो रीडिंग्स हैं वो डिसाइड करती है कि किस तरह से पेशेंट को नॉन फार्माकोलॉजिकल ट्रीटमेंट एज वेल एज फार्माकोलॉजिकल ट्रीटमेंट में हम लोग रख लें. अब देखिए, जैसे नॉन फार्माकोलॉजिकल ट्रीटमेंट होता है वेट लॉस, डैश डाइट, अवॉइड स्ट्रेस, सोडियम रिडक्शन, पोटेशियम सप्लीमेंटेशन, अवॉइड अल्कोहल एंड सम मेडिकल आफ्टर एडेंस. क्या देखा इसके अंदर, आपने अवॉइड करें आप स्ट्रेस को. अगर आप स्ट्रेस को अवॉइड करते हैं तो आप पेशेंट को निश्चित तौर पर देखते हैं कि उसका ब्लड प्रेशर अपने आप नीचे आता है. यू टू सजेस्ट रिगार्डिंग द वेट ऑफ द पेशेंट. इफ़ अगर पेशेंट का वेट ज़्यादा होता है तो देयर आर चांसेस ऑफ हाइपरटेंशन दैट पेशेंट्स. एंड फोर्थ इज सोडियम रिडक्शन. नमक आप कम खाना को बोलेंगे, अगर नमक आप कम खाने को बोलेंगे तो आपको उसके अंदर यू विल गेट द गुड रीडिंग्स इन दैट. आप उसको ये बोल सकते हैं कि सोडियम रिडक्शन का एक मेन तरीका है कि दैट यूज लो salt intake diet and advise the family members that sodium reduction should be necessary. और किस तरह का जैसे अचार है, मिक्सचर है, इस तरह की चीज़ों को थोड़ा सा अवॉइड करें जिसके अंदर यू आर गेटिंग अ बिग नंबर ऑफ सोडियम. अवॉइड अल्कोहल also causes bad effects in the patients who are suffering from hypertension. एक्चुअल में ये जैसे कहा जाता है कि अल्कोहल इज़ गुड फॉर हेल्थ, फॉर द कार्डियक हेल्थ, बट दैट इज़ अ वेरी डिफरेंट थिंग एंड दैट इज़ ओनली फॉर द रेड वाइन और वाइट वाइन, विच means that if you are taking the red wine or wine not more than 90 to 120 ml per day, it will be beneficial for the heart. But most of the time, like in India, if the patient is taking the country liquor at that time you cannot judge the level of alcohol in that case. So slow down, keep very calm, be positive in your life, take it easy, breathe normally, गहरी गहरी सांस लेते हैं, have fun and enjoy your life. unplug the stress and relax, go outside for some outing, just feel happy and you can meditate. अगर आपने मेडिटेशन को अगर थोड़ा सा ध्यान से अगर देखा है, अगर मेडिटेशन करते हो तो you will get very good improvement in the patients if the patient is meditated during his morning hours. So, diagnosis and management of hypertensive crisis. How will you diagnose and manage a case of hypertension? So, we much now we are following this regime. Like systolic blood pressure when the more than 180 mmHg, or when the diastolic pressure is about 120 mmHg, and the target hormone damage of the progressive worsening. अगर worsening करता है, yes, then hypertensive emergency with the hypertensive emergency, then हम लोगों को पेशेंट को एडमिट करना होगा आईसीयू में. अगर यही है कि टारगेट hormone डैमेज एंड न्यू प्रोग्रेसिव वर्सेनिंग अगर नहीं होती है, then अगर आप फादर के मार्केटली एवेलेटेड बीपी है, then at that time re-insulate intensely and that oral antihypertensive drugs therapy and arrange follow. It is important. But if you are getting the hypertensive emergency, then admit in the ICU and start means this is a level of class 1. So and just start the treatments. Admit in ICU and the conditions जिसमें आप इसमें देख सकते हैं, उसमें severe preeclampsia और eclampsia वाले patients हो सकते हैं. Second is aortic dissection, which will lead to such high pressure, and the pheochromocytoma crisis. We are talking about the crisis, so pheochromocytoma crisis. Okay, so when the conditions are there, so if the conditions are yes, then reduce the systolic blood pressure to less than 140 mmHg during the first hour and to less than 120 mmHg in aortic dissection. Okay, and if you are not having such kind of condition, then reduce the blood pressure by maximum 25% over the first hour, and then to 160 to 100 or to 110 mmHg over the next 2 to 6 hours, then to normal over the next 24 to 48 hours. So ये चार्ट आपको अच्छे से समझ में आया होगा. लाइक अब हम लोग इसमें देखते हैं कि the parenteral medications for hypertensive emergencies, and then we'll talk about the hypertensive crisis emergency, and these are the some drugs and then conclusion. So we are coming on the parenteral medications for hypertensive emergency. So the dosages which are very clear. What are the drugs, medications which we are using is like esmolol, phenodolpam, levetolol, nicardipine, nitroglycerin, nitroposide, and clevidipine. So esmolol in the dosage of, आप इसमें आराम से देख सकते हैं. डोसेज आपको थोड़ा सा एक्स्ट्रा अगर आप यूज़ करते हैं रेगुलरली, उसको यूज़ करेंगे इशू पे, तो आपको डोसेज अपने आप आराम हो जाएंगे. अदरवाइज लाइक 250 to 500 माइक्रोग्राम पर केजी बोलस और फर्स्ट मिनट, एंड देन 20 से 25 मिलीग्राम पर केजी पर मिनट इन्फ्यूजन, increased by the 25 to 50 mcg per kg per minute every 10 minutes up to 300 mcg per kg per minute. एडवर्स इफेक्ट क्या हो सकते हैं इसके? यही कि नोजिया, फ्लोसिंग थ्रोम्बोफाइब्रोडायबिटीज and first degree heart block. You will also find the first degree heart block in such cases. And the other drugs like phenodolpam, levetolol we are using in the rural practice. This drug is available to us, in which how we are using it. We will give it in 20 milligram bolus, then 20 to 80 milligram bolus every 10 minutes up to the 300 milligram total dose, or follow the initial holds by within 1 to 2 milligrams of infusion. What are the side effects of this levetolol? Is that hypertension, dizziness, diarrhea, scalp tingling, and the bronchospasm. Okay, so and the nitroglycerin mostly in the heart attack cases when the patient is suffering and in case SES, suffering from chest pain. At that time it will reduce the chest pain as well as it is reduce the blood pressure, which may lead to reduce the infarct. So here we are talking about only for the crisis. So at least 5 to 10 mcg per minute infusion you can start and increase by 5 to 10% mcg every 5 minutes up to 100 mcg per minute. What are the side effects of this drug? Like हम सॉर्बिटेड पे पेशेंट को कराते हैं तो बहुत बार स्ट्रेस फिनोमेना को देखते हैं हम लोग, हेडेक मिल जाता है पेशेंट में, डिजीनेस हो जाती है, फ्लशिंग मिल सकता है, Tachycardia भी हो सकता है and tachyphylaxis. So these are the drugs which are commonly available in the market like sodium nitroprusside. But sodium nitroprusside देने में हम लोग थोड़ा सा यूज़ करना पड़ता है क्योंकि उसको सन से थोड़ा सा लाइट से बचा देर उसमें उपरोट हो जाती है ड्रग उससे बहुत ज़्यादा उससे हम लोग फ़ायदा नहीं देख पाते हैं. So headache, eye flushing are some adverse effects of the drug. So now we'll talk about something about the hypertensive crisis emergency. ट्रीटमेंट बेस्ड ऑन द ऑर्गन डैमेज. सो ये हम लोग ये देख रहे हैं कि हाइपरटेंसिव क्राइसिस इमरजेंसी से आपको ट्रीट कर रहे हैं. आप देख रहे हैं कि टारगेट ऑर्गन डैमेज है कि नहीं है. अकॉर्डिंग टू द टारगेट ऑर्गन डैमेज यू विल स्टार्ट द एंटी हाइपरटेंसिव ड्रग्स. सो acute aortic dissection is good. Comorbidity is there. Acute aortic dissection. Then the preferred drugs which we can use is esmolol, levotirizol, nicardipine, and nitroprusside. If the comorbidities like the eclampsia or preeclampsia, at that times hydrogen and levotirizol and nicardipine will use. In the perioperative hypertension, we are using esmolol, nicardipine, and the nitroglycerins. And come to this side, acute pulmonary edema at this time, clavipine, nitroglycerins, and the nitroprusside are the preferred drugs which may lead to decrease in pulmonary edema and to help in maintaining the cardiac output as well as patient may go into heart failure. So we will use the nitroglycerin and the nitroprusside types of drugs. And now acute coronary syndromes इसमें स्टेबल दोनों आता है. साथ में ST segment elevation MI भी मिल सकता है. नॉन सिस्टिक segment elevation MI भी मिल सकता है. In that condition acute coronary syndrome we are using esmolol, levotirizol, and nicardipine and nitroglycerins. सो एक्यूट कोरोनरी सिंड्रोम सब इससे समझ गए हैं कि लेवोटिrizol निकार्डिपिन हम लोग यूज़ कर सकते हैं. साथ में नाइट्रोग्लिसरिन भी इसको प्रीफर कर सकते हैं. एक्यूट सिम्पैथेटिक डिस्चार्जेस और कैटेकोलामाइंस एक्सेस स्टेट्स एज द फ्रीगोमसाइटोमा द पोस्ट कोविड इंडोक्टोमी. अगर हमको ये कोमोर्बिडिटी मिलती है तो हम लोग क्या यूज़ करेंगे. निकार्डिपिन एंड क्लोरोडिपिन इज इम्पोर्टेंट. एक्यूट ICH अगर होता है तो लेवोटिrizol निकार्डिपिन हम लोग यूज़ करते हैं. सॉरी थोड़ा सा स्लाइड इसमें कट गया है एक्चुअल में. और मैं आपको वीडियो एक्सप्लेन करूँगा. सो सॉरी फॉर द डिस्टर्बेंस. नाउ मैं आपसे क्या बता रहा था कि हाइपरटेंसिव क्राइसिस इन इमरजेंसी टेस्ट बेस्ड ऑन द टारगेट ऑर्गन डैमेज. सो एजेंट्स फॉर द मैनेजमेंट ऑफ हाइपरटेंसिव अर्जेंसी, क्या क्या एजेंट्स होते हैं जो कि अर्जेंसी में हम लोग को काम आते हैं. उसमें आपको जैसे कैप्टोप्रिल, क्लोरीन, लेविटलॉल है ना. कैप्टोप्रिल मीन्स AC1 एंजियोटेंसिन कन्वर्टिंग एंजाइम इनहिबिटर्स हम कर सकते हैं. व्हेन वी आर यूजिंग इट ऑनसेट ऑफ एक्शन 5 से 15 मिनट एंड ड्यूरेशन ऑफ एक्शन 2 से 6 आवर्स तक हो सकता है. डोजिंग जो होती है उसके मिलीग्राम डोज है 25 मिलीग्राम पर ओरली एंड डोजिंग रेंज फ्रॉम 6.25 टू 50 मिलीग्राम पर ओरली एंड मैक्सिमम डोज इज अबाउट 50 मिलीग्राम पर ओरली. Adverse effects are hyperkalemia, angioedema, rash, decreased renal functions, and renal artery stenosis. Now, clonidine is a central acting agonist होता है जो 15 से 30 मिनट का इसका एंसिड्यूरेशन वैक्सीन होता है. इसका असर होता है 2 से 8 वर्ष तक. रेमडोज इसकी जो है 0.2 मिलीग्राम पर ओरली है, फॉलोड बाय 0.05 to 0.1 मिलीग्राम एवरी आवर अंटिल द डायरेक्ट इफेक्ट्स. इसके भी साइड इफेक्ट्स होते हैं जैसे कि ड्राई माउथ, सेडेशन, ऑर्थोस्टैटिक हाइपोटेंशन एंड रिबोन हाइपोटेंशन. एंड द लेवोटिrizol अल्फा सेलेक्टिव होता है क्लास इसकी. डेटोनॉल सेलेक्टिव एगोनिस्ट होता है. ऑनसेट ऑफ एक्शन इज अबाउट 2 आवर्स एंड ड्यूरेशन इज अबाउट 4 आवर्स. रेगुलेशन 200 मिलीग्राम orally फॉलोड बाय 200 मिलीग्राम एवरी आवर अंटिल डिजायर्ड इफेक्ट्स. मैक्सिमम डोज 1 से 200 मिलीग्राम होता है. Adverse effects: hypertension, dizziness, headache, nausea, and vomiting. So now here we are in the conclusion. In case conclusion, हम लोगों को ये देखें इसमें कुछ पेपर्स भी पब्लिश हुए हैं जिसके अंदर में हम लोग देखते हैं कि hypertensive crisis can be a source of morbidity and the mortality in the pediatric population as well. Okay, so now we are going into the detail. Drugs to be used in case आप इसमें देखते हैं चिल्ड्रंस का पेडियाट्रिक ग्रुप का, ये मैं आपको बताऊंगा. फर्स्ट हम लोग इससे कंक्लूजन पे आ जाएं. कंक्लूजन हम लोग का ये हुआ इसमें कि पेशेंट विद हाइपरटेंसिव क्राइसिस exhibits severe elevation blood pressure that can lead to extensive morbidity and even mortality if the hypertension is poorly managed. Second thing is the appropriate therapeutic approach in a given case depends on the patient's clinical presentation. Patients with hypertensive urgency, leg and organ damage, and can be treated with an oral medications that gradually reduce the blood pressures to goal over a period of several hours to several days. Hypertensive emergencies, on the other hand, requires intense monitoring in an ICU setting and IV therapy with the goals of halting the progression of end organ damage. Through their expertise in treating medication and the knowledge of the pharmacotherapeutic options, pharmacists can have a positive influence on the care of the patients in the hypertensive crisis. So now इसमें आगे बस इतना है कि आपके लिए भी इसमें आई विल नॉट गो टू द डिटेल्स बट drug to be used in as in is oral or parenteral. In case parenteral, levodopa, esmolol, dicardipine, clozapine, sodium nitroprusside, hydrolysin, and phenol and oral therapy is azathioprine, clonidine, nifedipine, and minoxidil. So conclusion क्या निकलता है इसमें? Hypertensive crisis can result in a significant harm to the pediatric population, not only as it is commonly associated with the morbidity rate up to 4%, but is also associated with the air organ damage in the following patients' hypertensive emergency. As much as it is utmost importance to diagnose the underlying causes and concomitantly treat the hypertensive crisis, although there can be a paucity of information on the prevalence, incidence of the hypertensive crisis. Potential dangers to neurological, visual, cardiac, and renal structures are well known. By understanding and further building upon the current knowledge on the etiology and the diagnosis and management of hypertensive crisis, in addition to the utilizing novel technological and breakthrough clinicians worldwide may further refine diagnosis and management of the hypertensive crisis in the pediatric age group population. So from where we are getting the references, here are some of the references. You can see easily here. आप चाहें तो इसमें इससे रेफरेंस को ले सकते हैं और इससे आप थोड़ा सा एक्स्ट्रा इससे हाइपरटेंसिव क्राइसिस के बारे में बता सकते हैं. Now from tomorrow onwards, from today onwards, we will take one topic from each system जिसके कारण कि आपको इंटेंसिव केयर यूनिट में पेशेंट्स आपके आते हैं. So it is very nice to talk to you in this lecture. Now after some time I will take my other lectures. तो आप लोग प्रिपेयर होकर हैं, जैसे कि हम लोग को इसमें पढ़ना है कि न्यूट्रिशनल मैनेजमेंट, ICU, मैनेजमेंट ऑफ अनकॉन्शियस पेशेंट, मैनेजमेंट ऑफ लाइक दिस हाइपरटेंशन एजेंसी तो हम आपको पढ़ ही चुके हैं, pancreatitis, okay, and sepsis, and more thing is like पेशेंट्स विथ ARDS पेशेंट्स. जैसे कि अभी कोरोना गया तो आपने देखा है कि अधिकतर जो डेथ्स, मोस्ट ऑफ द डेथ्स ऑकर्स बिकॉज ऑफ ARDS. नॉट जस्ट कोरोना इज द पॉजिटिव फैक्टर बट द ARDS may lead to death in many cases. So we'll talk about the ARDS and talk about the some ECG findings, as well as we'll talk about sepsis and some infections related disease. So I will talk to you after it. Thank you. Sorry, the video is still continuously but so there is some difficulty in my this. Okay, so I am giving the some slides of this topic by which you can easily remember that what is normal blood pressure and what is the blood pressure stages, and what is hypertensive urgency, what is hypertensive emergency, what is drug called hypertension, and the findings which findings mostly in case of acute coronary syndromes, and The other thing is like that the findings in non-ST segment television as well as ST segment television. So thank you. Now we'll talk on some other topic after some time. Thank you. Thank you.